Cannabinoids in the treatment of epilepsy. Definition: Epilepsy: a disorder of the nervous system characterized either by mild episodic loss of attention or sleepiness, or by severe convulsions with loss of consciousness. Issues relevant to use in epilepsy treatment. Synthetic cannabinoids, since they are not derived from the cannabis plant, are sometimes subject to less restrictive scheduling if clinical evidence supports medical usefulness.
Epilepsy affects nearly 3 million Americans, but who is really at risk?
Epilepsy can develop in any person at any age. Almost 1% of people develop epilepsy during their lifetime. That's 60 million people worldwide. In other words, out of a 60,000 person stadium, about 500 will have epilepsy. New cases of epilepsy are most common among children, especially during their first year. The rate of new cases gradually declines until about age 10, and then becomes stable. After age 60, the rate starts to increase again. Many famous people in history had or may have had epilepsy, including world leaders like Julius Caesar, writers like Lewis Carroll, Alice in Wonderland, artists like Vincent van Gogh, and athletes like Chanda Gunn, goaltender for the U.S. Olympic hockey team. The causes of epilepsy can be divided into two groups: brain injuries and chemical imbalances in the brain. Anything that injures the brain can lead to seizures. But in over half the cases, no cause can be identified. The type of injury that can lead to a seizure is age dependent. Seizures in children often are caused by birth traumas, infections such as meningitis, genital abnormalities, or high fevers. Seizures in the middle years commonly are caused by head injuries, infections, alcohol, stimulant drugs, or medication side effects. In the elderly, brain tumors and strokes cause a higher proportion of seizures. Not all seizures result from a structural problem in the brain. Chemical imbalances also can cause seizures. Common chemical imbalances that produce seizures include drugs like alcohol, cocaine, and others. Low blood sugar, low oxygen, low blood sodium, or low blood calcium. Kidney failure or liver failure can also produce seizures. Doctors will evaluate these imbalances by taking a careful history and doing blood tests. Although these disorders and injuries can explain many cases of epilepsy, often the cause of epilepsy remains idiopathic, which is the medical term for unknown. About half the time, no cause for a seizure can be identified. Fortunately, we do not need to cause to treat seizures. Scientists increasingly recognize the importance of genetic factors in the origin of epilepsy. Genetics or heredity are most relevant to generalized seizures, including absence, generalized tonic-clonic, and myoclonic seizures. Defects in genes don't lead directly to epilepsy, but they can alter the excitability of the brain in a way that predisposes it to seizures. Typically, epilepsy develops because of multiple gene abnormalities or a gene abnormality in concert with an environmental trigger. Parents with epilepsy wonder whether their children will have epilepsy. In most cases, they won't, but they do have a higher risk than others. If the mother has a generalized type of epilepsy, the child's chance of having epilepsy may be as high as 5 to 20%. But if the parent has epilepsy due to a brain injury, the child's chance of having epilepsy is only about 5%. If you or someone close to you is suffering from seizures, please see a physician.
Perceived therapeutic benefit. The gap between patients' beliefs and available scientific evidence highlights a set of factors that confound cannabinoid research and therapy, including the naturalistic fallacy, the conversion of anecdotes and strong beliefs into facts, failure to appreciate the difference between research and treatment.
Partial onset seizures, otherwise known as focal seizures, remain a treatment challenge for some patients despite a number of therapeutic options. Thus, there is substantial need for additional anti-epileptic drugs. The inhibition of voltage-gated sodium channels is a mechanism by which a number of anti-epileptic drugs may work. Sodium channels are key proteins involved in action potential firing in most excitable cells, mediating the transport of electrical activity through the brain. Neural impulses are conducted by the opening and closing of sodium and other voltage-gated ion channels, which regulate neuron excitability by allowing passage of ions across the cell membrane. Sodium channels are closed in the resting state. With mild membrane depolarization, the sodium channel opens, allowing an influx of sodium. As the intracellular concentration of positive ions increases, the inactivation particle quickly closes the channel, stopping the inward flow of sodium. The sodium channel is now inactivated and remains unavailable until the cell membrane potential repolarizes. Recovery from inactivation allows the sodium channel to participate in the next action potential. A sustained succession of rapidly occurring action potentials may spread to involve surrounding neurons, which may trigger an epileptic seizure. One type of sodium channel blockade modulates repetitive neuron firing by prolonging the inactivated state of a depolarized sodium channel.
Conclusion. Preclinical and preliminary data from studies in humans suggest that cannabinol may be effective in the treatment of some patients with epilepsy. However, current data from studies in humans are extremely limited. The use of medical cannabis for the treatment of epilepsy could go the way to vitamin and nutritional supplements. My clinical case: Bowen syndrome, multiple clinical manifestations during their long evolution. Abstract. Being a multisystemic disorder, Bowen syndrome has different clinical features that compromise multiple organs. The referred acronym polyneuropathy, organomegaly, endocrinopathy, monoclonal protein M, and skin changes result in insufficient when this syndrome is described, because of the constellation of multiple signs and symptoms. Includes papilledema and intracranial hypertension less frequently. My clinical case: 44 men with motor deficit in the lower limbs that had become progressively preceded by paresthesias. Electrophysiological studies show a demyelinating polyneuropathy with a secondary axonal loss. The cerebrospinal fluid protein levels revealed 223 mg per deciliter 2 cells. He received oral prednisone. A spinal X-ray showed a bone injury in the body T12, which has diagnosed radiophilia as simple bone cyst. The patient was improving slowly and began to walk alone. Conclusion. Bowen syndrome is treatable. The outlook depends on the diversity of the systemic involvement, taking into account that many signs are appear over time. With radiation therapy on bone injury, patients improve substantially, but such improvement occurs slowly. The neurological improvement is very obvious. If the lesions are multiple, are there whispered demonstration chemotherapy is required.